Hi everyone, it's Kat from Williams OT.
G'day.
And Brad.
Yeah, g'day everybody. Brad here as well from Williams OT, and this is our series on wheelchairs. It's called What About Wheelchairs? Make sure that you tune into all of the videos if you want to know about what goes into a wheelchair assessment. These sessions are to inform you as a wheelchair user or potential wheelchair user about what goes into the assessment process, what goes into making those decisions about wheelchairs, so you can come informed with a lot of knowledge in your head so we can get the best outcome for you. Now, Kat here is our lead OT at Williams OT. She's got so much knowledge. I am learning so much in these series. Today, we're talking about cushions underneath the bottom and why that's important. If you tuned into the last video, I had my measurements taken on the twin, and this is a hard foam, and I couldn't sit up straight on it. And all of a sudden in this wheelchair, I'm actually sitting up much straighter because I've got a softer cushion underneath my bottom. But we're going to go into, is there a better cushion for me? And if I've got certain issues with my posture or with my positioning, my hips or my back, what kind of cushion might be better for me for my comfort, but also pressure.
Too.
Do you want to unpack what we mean by pressure and what are pressure sores? And there might be something brand new to somebody who's going to a wheelchair for the first time.
So before we go into lots of cushion types, and just a thank you to Extra Care for hosting us today. They've loaned us all of these cushions.
So many.
So one of the key components about a cushion for a wheelchair user, because of the length of time that you often sit in the chair and not necessarily doing any sort of a weight shift like this, often pressure can build up underneath your bottom. And when we talk about the pressure build up, it's often the bottom bony parts of your pelvis. We call them the ITs, the ischial tuberosities. So those bony bits, when you're sitting on a static surface for a long amount of time, or even if you're sitting a little bit lopsided, then all of that pressure is going down into that bony part. But the problem is the tissue and the skin underneath your bottom, if you're not changing the pressure that's going downwards, and potentially if there's some incontinence problems or any of that, it means that you're at high risk for a pressure injury.
Yeah, so if your skin's slightly wet, then that's going to start breaking down the skin. That's a real concern.
We do not want that, because once you get a pressure injury, it's very difficult to address it. So we are all about prevention.
Yeah, if you've got a spinal cord injury or something where sensation is impacted, you might not even know that it's coming on. You might not be able to feel that you're getting a skin fold, which then turns into a rubbing friction type of issue. And then once that happens, then you get a breakdown of the surface, and then you might have this, it's a terrible ulcer, and they can look horrific, and they are terrible. And once you get an ulcer, then it's all about infection control. We don't want to go there, and that's what this is so important.
So winding back to what we're covering today in terms of cushion range, from a therapy point of view, when we think about the appropriate cushion or the best match for your needs, there's a few components we think about. First of all, for me, it's about alignment. So it's about alignment of your pelvis, because everything to do with your posture in a seated position in a chair, it all comes from your pelvis and your hips. So that's why we do such a thorough assessment before we even go near a wheelchair. And once we know if you have a slight alignment issue with your hips, so this poster here I've got actually shows a few of the different positioning issues. Sometimes you may have a pelvic tilt like this, which means if you're tilting backwards, it means you're going to have more of a C shape in your spine. That affects the way you sit. Also, if you're tilting forwards, you're going to have a big arch in your lower back. So that's putting lots and lots of pressure, and it means that you've got to work really hard to keep your head upright.
I know there's a client that you've seen recently who sits in this position and basically sits on her arms because of poor support and poor positioning.
And that's part of their condition, but also your body is, in order to function from day to day, your body is naturally going to try and compensate for those alignment issues. And in order to maintain eye contact, to do the things you want to do, to interact with people. So often you're going to start to compensate by like arching your head position or muscle tightening that we often see. But what we want to try and do is correct what we can correct while those postures are a bit flexible, so that we can prevent any further changes as much as possible. So what we'll do today is I'll go through a bit of a range and why we might consider one over the other. And as a starting point, for somebody who's reasonably active and in terms of pressure, is able to weight shift like this in their wheelchair, then I might just look at a simple foam cushion with a slight contouring. I don't know if you can see because of the light, but there's a slight contour at the front of this, which are just for the upper legs.
Which I don't have in this good. I'm on a very standard flat cushion. It has got two levels of foam in it. It's got a harder foam and then a memory foam on top. If you think about the new mattresses for your bed now, it's a bit more like that. It's got the firmer one and then the softer one on top.
So
there we go.
This is what this looks like inside. So it's a mould. You've got a bit of higher, slightly higher on the edges to keep your upper legs in alignment. But then there's actually this little lower bit. This is where the bony points of your hips will sit into. So this is the back of the cushion like this.
What you can see is the indentations stay there for a long time. Hopefully you can pick that up on the video. But that's what a memory foam does. The memory foam absorbs the bony points rather than trying to bounce back. Now, if you get a hard foam like this is or like this is, it's trying to rebound. It's trying to push you back up again. You sit in it, but it's more like a trampoline that comes back again, where the memory foam absorbs those bony bits.
That will mould to your body shape.
Yeah.
So on the sides here, you can actually see these are 3 different densities of foam. So on the sides, this is slightly firmer. I can feel that. Brad, if you want to feel that.
Oh yeah, that's
it's
like
slightly
this.
firmer, but that will keep your legs in alignment. Underneath the bottom, slightly softer, but that's just so that you don't bottom out, so that the top squishy layer isn't flush with the base of the wheelchair seat. So you've still got some cushioning underneath, even when this is compressed.
It's like putting a thin memory foam that you get on a bed. Most people can picture a bed, but it's like putting a pillow top on the top, straight on the wooden frame. It doesn't work that way because you sink through and hit the wooden frame. You need the foamy bit underneath to help keep you elevated.
The other thing to think about as well with cushions is the type of cover. So you're always going to have a top layer which is breathable fabric, and underneath you've got your heavy duty Velcro which is going to secure it to your wheelchair, around that way, like that. So what you can do as well, if you do have issues with continence problems, then we can, within this, one of the other ones has got it, just here, within the breathable cushion outer cover, there's a waterproof incontinence cover, which as well can be washed, and we often will order 2 of those. Just so that one to wash, one to use, just so that that's nice and discreet and it protects your cushion.
Very good. Kat, I feel like, well actually I know, but there's different levels of pressure care. There's different, so people might hear that they're a level 1 or a low pressure or medium pressure risk or a high pressure risk. there's different ways of assessing that, and some of the things that go into that are incontinence.
Yeah, incontinence is one thing. If you have an alignment issue with your pelvis, that's another indicator. Past history of pressure injuries as well, another indicator.
And your ability to actually shift your body weight off of those bits that are getting a little bit sore at times as well. So if you're a low, medium or high pressure risk, then a different cushion might be, you might think that you need a big cushion or a cushion with gel in it. But if you're at a higher risk, then the OT, such as CAT, may prescribe something that is a little bit more, slightly different, got more components to it, to help you avoid those pressure issues and potential breakdowns and so forth. So
the other thing to think about as well is that a lot of long-term wheelchair users will have a personal preference. So they may be used to foam, they want something that feels like foam, and they may have strong opinions about going to an air cushion or a gel cushion. So we'll leave the air cushion for a sec, because in terms of pressure relief, this is pressure reducing with the memory foam, fairly low level, so you're not going to get a huge amount of pressure relief from that. The next step up that I would probably think about is a contour. So I'm just going to have a little look here at our choices. This one here, what have we got there? Actually, we'll go to the next. This one here, and yes, it's a bit higher profile, so we do need to think about that according to whether you're using a manual chair or a power chair.
Which actually might suit me a bit better, because my knees, as you can see, my knees are going up into the air. This cushion actually might be better for me just in regards to height for this wheelchair, but then again, then my backrest goes out. I can feel my backrest is too low. So it's about weight. It's where all these measurements come in.
Generally, in our manual wheelchair, we're trying to keep a fairly low profile cushion, because if you're an active user, it is going to throw all of the measurements of your wheelchair out by going to a thicker cushion. So we do need to think about that. Sorry, I'm just about to crunch this label. Which way? That way. There we go. So I just want to show the inside of this cushion. So this
another different type of
is
foam. Look at
similar but different type. So this particular cushion has a really spongy top. So you feel that, Brad? That's super spongy. But then different layers of memory foam.
Yeah, that's a real rebounding
so
one.
You're going to get really good immersion. That's what we call it when you sink into the cushion. You get good immersion. And it's also quite stable to sit on, so you don't feel like you're shifting around all over the place and can't quite get your balance. This is going to be nice and stable to sit on, but nice, cushy feel underneath as well.
I just want to try that on your pants. I really do.
I think it's a bit too wide, but we can try.
We can
switch it.
See if we make a difference. But look, that is got a lot of extra technology involved in it,
and also,
much higher level.
Sorry, one thing that we forgot to say is the air circulation underneath your bottom for pressure relief. So the different designs of these pressure relieving cushions, something like a Roho air inflated cushion, one of the reasons they are so good for pressure relief is because there's lots of airflow underneath your bottom for the tissue, for air circulation, and that helps with preventing moisture buildup.
Just while you're doing that, have a look at the thickness of this cushion. This cushion here, if I get it up against a white background, it's like micro, really. It's very, very thin. It's got the 2 layers of foam in it. It's got the memory foam on the top, the blue spongier one, the one that you sit in, and the harder foam underneath, the one that you sit on. But that one compared, it's just bigger depth, more layers. It's I feel like I'm going to be sitting on a cloud when I put this one on.
The other thing with this, in terms of going to a thick cushion, there are some little adjustments that we can do.
Oh, okay.
If you went for a higher profile cushion, what you can do is adjust the foot plate height as well. Unfortunately, this one doesn't have a lot of adjustment, just because that's the chair that it is. But if you have an inch or so of adjustment that you could increase the height of your foot plate, then that will account for the extra height of the cushion that you're putting on top.
Just give it to me, Kat. I want to sit on it. I want to sit on it. It just looks so much more comfortable.
There we go.
Oh yeah, oh, I'm sitting in it straight away. I can feel it's kind of tipping me into the cushion. It's rotating my hips in a little bit so my knees come together. But on that other one, I can feel the pressure of my legs against the hangers here. It's a new term that I've learned, by the way, through these video series. Now my legs don't feel like they're pressing in on there as much. But look, I feel very comfortable.
Okay.
I feel very good.
So then that's our next step up. The next one I want to show is something with gel in it. So what we were talking before about underneath your bottom, if you have had a history of pressure injuries, or we really want to prevent, and you don't necessarily like the idea of an air inflated cushion, then we'd look at something like this, which is a JX2. So J is a brand of cushions and wheelchair accessories that is quite well known. I just want to show you the design of this because it's quite unique. So the front part is very much, the front part is very much like the foam that Brad's been sitting on previously. However, the back part that sits underneath your bottom is all gel. So Brad, if you feel that, it's really moldable.
Yep.
So what
it's like a jelly in there.
It's like a jelly.
It's actually even a softer jelly. It's like
a jelly. But what you need to remember with gel cushions is that if they're cold, they're going to fix in one position. So what you need to do regularly with a gel cushion in terms of maintenance is take the cover off, give it a bit of a punch, readjust where some of this is sitting so it's flatter, and then sit on it like this. So this is the hips that I'm demonstrating here, and then you're going to sink into it like that. So what that does by adjusting it, if you keep sitting in the same position over and over again, and keep sitting down in the same spot, I'm exaggerating, but I don't know if you can see here how
they're really
deep that
deep
is.
wells there.
But what's underneath that is actually a pretty thin layer of foam. So it means that if you don't adjust your gel cushion and you keep sitting in the same spot, people say, oh, I'm really uncomfortable. That's because you got very little between, and all of a sudden, all of the gel's kind of gone out sideways. So you do need to maintain it.
I'm just picturing a bowl of jelly, and you keep pushing down through the middle, it's all going to squish out the
it's all
sides.
squish out to the sides.
Yeah.
So this works really well for some people, not so well for others. The other thing is gel can be a little bit heavier. That's the other consideration.
It is quite a lot heavier compared to the one that I'm on now with the foam. So that whole taking it off of your wheelchair to put in your car, it is going to add a little bit of weight to your shoulders. But look, I'm fascinated to test that one out underneath my bottom as well. And this one here has just really got the white foam, the more bouncy, reboundy foam.
And the other little thing, just turning it upside down reminded me, there is a front and a back to all of these cushions. So make sure you check that you are sitting on it the right way. I've seen cushions upside down, round the wrong way. They don't do what they're meant to do if they're like that.
All right, so what's the next step?
So, since we're talking about pressure, I thought we might talk about an air inflated cushion or a Occupational. Now this is a really, really big cushion, but we're just using this for demonstration purposes. Now most people who have been around wheelchairs for a while know about Occupational cushions. The benefit of these high profile cushions, they're individual air cells and you can pump them up a bit like an air mattress. They have a valve at the front. This particular one is a quattro, so it's in 4 segments. And this little gadget on the front actually allows us to open up those quadrants so it's equal, or we can lock it and specifically inflate one side more than the other if we want to compensate for some of those alignment issues that we're talking about.
Yeah.
The thing,
So when you go to sit in it next time,
yeah,
that component has the same amount of air
it's
as it
just-
had last time.
yeah. So it locks it in place,
Yeah.
so it prevents all the air from flowing through the whole thing. One of the biggest mistakes I tend to see with rohos is not being inflated correctly and not being checked enough. So what you find is the best way to do it. A roho is designed that you are supposed to be able to sit into it and be enveloped by those cells. If it's flat, you're going to bottom out and you're going to sit on the base. If it's too much, you're actually going to kind of balance on top and you're not getting any of that airflow that you need to get.
Yeah.
So
you don't want it to be like the white foam, where it's really reboundy, which is too much air, and then you don't want it too soft with no air in it, and your bottom is basically sitting down on the wheelchair.
Yeah.
And quite often people haven't done up the valve just tight enough, and it just slowly leaks air over time. You might have a little pinprick hole in it. These things do require a little bit more maintenance, but they are one of the higher levels of cushion and pressure relief.
Yeah. The other thing to remember with a roho cushion, the valve should always be on the front left of the person's wheelchair seat.
Yep.
If it's around the back, it is around the wrong way. So you need to have that position correctly. Obviously, the air cells go up. I have actually seen someone with it like that before. It does happen. And that can be really simple. If somebody puts the cover back on upside down, it's a simple mistake to make. But with a roho, in terms of maintenance, you do need to check it. I like to say at least once a week by someone who knows how to check it properly. If you are prescribed one, your OT should go through maintenance and provide you with some information about that. What we do is you overinflate it, get the person to sit on it, and then the manual test is to slide your fingers underneath their bottom, and you should be able to wiggle your fingers about 3 centimetres, an inch, and there should be an inch between their bottom and the seat base. If it's any less than that, it needs more air. If it's more than that, it's too much. So,
just at the back there, Kat, the other one there, there's a different, on this one here, you've got different heights of those cushions, from a real low profile roho cushion through to a really high profile roho cushion, and that all depends on the person's needs and risk.
Yeah, one of the things with roho cushion, I'm going to sit on this one quickly. Okay, so I'm going to be with my feet in the air. You can see my feet dangling there. That's okay, it's a demonstration. I'm now sitting right on top. I can feel there's too much air in this. So the issue though is that you can see me wiggling around like this. For people who have some movement problems and are not confident with some wheelchair transfers, sitting on a roho cushion can feel really unstable. So it works for some, but not for others.
Yeah, for me personally, with my ability to move, I feel too unstable on roho cushions. I feel like I'm really wobbly, but if I had a pressure issue, there might not be much of a choice, and I would have to do that because the risk of the pressure sore would outweigh that instability feeling. We're a driving service. I'm just going to make a point about these. You shouldn't really put these cushions on top of a car seat. They increase your risk of submarining underneath the wheelchair, and it impacts on where your seatbelt should go. So if you're
the steering wheel?
on the steering wheel, but especially as a passenger as well. Some people put the wheelchair cushion over onto the passenger seat. Look, it's not recommended because of those risks of where the seatbelt will sit. Also, it increases your height, so is your head now touching the roof of the car? All of those things need to be weighed up. It's something that should be really strongly considered of whether that's an appropriate thing for you. So, putting in a cushion on top of the car seat cushion, it's not really advisable, especially if it's something that's really mobile like this.
We have, having said that, we have looked at some of our clients that I've worked with as well. We've looked at some different types of cushions that don't don't move quite so much and have been a lot more stable. So if you do have questions about cushions on your driver's seat, definitely make a time to come and see us.
Yeah, there might be a specific cushion that is better suited for you for that purpose, rather than just putting a wheelchair one on there.
Yeah. Okay.
All right. So, just really quickly, I'm more of a fan of the foam one with my bottom shape compared to this gel one. It's just for me and the feelings that I'm getting through this cushion, the foam one suits me better. Yeah. But also I'm not at as much risk of a pressure issue. So I can just feel that one, I feel comfortable in this one. I feel supported in this one with the gel. There's no issues with my bottom, that's for sure. I can't feel any pressure through my ITs, my ischial tuberosities, those pelvic bones. I can't feel any of that. Just in general comfort, I do like that foam a little bit better. So it's about choice, I guess.
This one, I just thought I'd show this quickly. This is a bit of a new brand, but the concept has been around for a while. This has a bit more of like a honeycomb style covering. So this particular company make this gel sheeting, and it can be used in cushions, it can be used in armrests, all sorts of stuff. It's really interesting because underneath it's got that multi-layer foam, but the top you can see that honeycomb sort of effect. You've still got good air circulation.
So it's a real honey, like this is what we're talking about by honeycomb. It's little squares that collapse in on each other. You can see in the middle here how they've collapsed in on each other because of the contours of the cushion.
It is a very, very different feeling. And again, these are really subjective. Like what one person likes, the other person may not. That's the front.
It's got the contours for the leg and the hole for the bottom to sit in.
So how does that feel? Can you wiggle around a little bit?
So for me, it's got a little bit of movement like the Roho, but I can feel myself sinking into it as those squares kind of collapse on each other.
Yeah. So it's quite an interesting concept. And there are some similar cushions that have a much deeper design of that honeycomb effect, which are really quite heavy. But this is just a new colour. Yeah, something different.
But I think the way that it folds down on itself, it's actually rated fairly high for pressure.
Quite high. Yeah.
But you can get a lower profile.
Yeah, so that's almost like a compromise. It's better pressure relief, but it doesn't have the instability that you might be looking at with the
Now, I have been fascinated by this one, Kath.
Okay.
Alright, so this one here is different to every other cushion that we've got there. So getting it against the white background, it's got quite a big contour and curves to the front. Why would I want that?
So for something like this cushion is made by Specs. It's a deep contour or a high contour cushion. So you can see these leg channels, and this is designed for people who have real issues with their upper leg positioning and needing to keep them level within the cushion. So at the back part of the cushion, quite often we'll find combination cushions which will give you those leg troughs, but in the back you've got some choices underneath your bottom as to whether you need an insert underneath your bottom or not. So you can add that with a gel addition. So this one here, you can see it's round size. So it's actually got extra bolsters, which are kind of like just to provide the extra stability on this cushion. And that's actually removable with the Velcro. So you can take that off if you don't want the cushion quite so stable on the edges. But there's also, I don't know if you can see that, it's a bit hard because it's dark, but I'll bring that closer. See these little pockets underneath. So if you wanted, underneath the bottom, what we were talking about before with the pelvic tilt, so there are actually foam components here which we can build up one side of the cushion over the other. So what I can do is I can use either a half pad like this just to build slightly, and what I'm going to do here, right, so this is upside down, this is where the bottom sits. So I would be looking at pad like this to add in. Actually, this has too big.
That's not the right size.
That's
for
okay,
this-
not
for
the
this
right
one.
size for this cushion. But if the person has a tendency, I can't do this and hold it. If you have a tendency to slide forward with the pelvis, like we were talking about, what we want to do is create a shelf, like just in front of those pelvic bones. So this isn't going to fit either. But what we would do is add some extra padding underneath, and we would build up the front of the cushion, which means in profile, the bottom sits here, and then it actually prevents you from sliding forward in the chair. So we actually build up all of this, so it's all level, but the back sits down. Yeah.
So that's to stop the submarining, the slipping out, the building up of the front,
Yeah.
brings the knees up, so there's more ability to be pressured back into the seat.
Yes. Now, there is one other cushion that I did want to show, and I just can't place it at the moment.
It's
There,
gone missing.
it's gone missing. It's the same company as makes this one, but what you can do is, it's a bit like a puzzle piece, I suppose, to be able to customize it for the person. What we can do is we can shift the side sections slightly angled if your legs tend to do this, and that's what we call side sweeping, or windswept look. So we can actually change that in the cushion to suit your body shape. There are components we can change around underneath the bottom. So if I put it right way up, underneath the bottom here, we can also change where the central panel is. It's got a Velcro section, and we actually can move it across according to where the legs sit. Same with the external leg guides, we can actually change them as well.
There is one extra layer above this where we can do like really high level customized seating as well.
Yep.
We haven't got that available to demonstrate here, but you basically sit on like a beanbag type of substance, and you sit on it, and we get you in a good postural alignment, and then suckle the air out of it, and that becomes the shape, set shape, and then that becomes what is called the CAD drawing, the CAD shape, and then they're able to shape foam, shape all kinds of other things to be able to get exactly the right shape for you based on your bottom and your unique bottom.
And I guess that highly customized approach is something that we wouldn't always do now, because there's been so many
much.
changes in new products available on the market. We can now customize a whole lot of stuff and don't necessarily need to have that approach. But if you have really complex postural needs, then we can also explore that approach. Yeah.
All right. Well, as you can see,
That's a lot about cushions.
that's a lot of cushions, and we haven't probably even
Haven't
touched
explored
on all of them at all. So if you want to know more about the right cushion for you, as you can see, it's quite complex. There's lots of different layers. There's lots of different things to consider in regards to you as a wheelchair user. So having a referral, making sure that you get the right assessment with somebody that knows their stuff, somebody that is a leader in this area might be what's required for you. Make sure you do a referral to Williams OT. We'll be there to help you out for a wheelchair assessment, making sure that you're getting the right wheelchair, the right cushion, and maybe even the right backrest. We'll talk about backrests in another video. So make sure that you tune into that one as well. That's another video in this What About Wheelchair series. A special shout out to Extra Care for hosting us today, allowing us to demonstrate all of this stuff here. It's been fascinating. I've learned something along this journey as well, Kat, so thank you very much.
Okay, see you guys. Bye.